Okay, in this video, we're going to show a lacrosse ball treatment to release some of the pressure of the abdominal muscles along the crest of the hip bone. So this is our muscle man chart, so you can't really see the bones well. However, where this crest is, you can see that white mark. That would be around where your hip bone is. That's where that muscle actually connects to. So on the front side of the body, it would be along this edge here. Often, if somebody has lower back pain, these muscles can actually become too tight as a form of protecting the lower back. And most notably, the psoas muscle that comes down through the body and connects down into the front side of your lower leg bone. So those can become too tight as a form of protecting the lower back. If they stay tight too long, they can actually cause other issues. So I'm going to hand the camera over to my lovely assistant, and I'll show you a therapy for that. There you go. Thank you, thank you. So, in this therapy, we're actually going to use a lacrosse ball. And what I'm looking to do is I want to find the front side of my body along the crease of my hip bone. So you can feel where the bone is. I actually want to come to the inside of that where my musculature is. So if I were to take the lacrosse ball and press it on the bone and then lay down on it to create pressure, that would be very uncomfortable. So we don't want to actually be on the bone. We want to be just inside the bone along the crease. So it actually kind of forms like a V into our pelvic muscles. So I want to have the lacrosse ball start up where the top of that bone is, but again on the inside edge of that. And then I'm going to actually be laying down on my belly and I'm going to be creating pressure with my body. But I want to have the lacrosse ball roll down through that V area. And what it does, it creates pressure into these muscles. Our body then registers that those muscles are actually tight because of the pressure we put on them. We're going to do that for 30 to 60 seconds. When we release that pressure, the body will then release some of the tension that it previously had in those muscles if it doesn't feel that level of tension was necessary anymore. So when someone first gets hurt, these muscles can cramp down, tighten down, be too tight then as the original issue for the injury heals. They stay too tight. So this is a way to kind of get them to coax, to loosen back up. So I'm going to go ahead and show you what it looks like. So I'm going to lay on the floor. And what I'll be doing here when I lay down, you won't be able to see the lacrosse ball anymore. But again, I'm looking for the inside edge of that bone. And I'm going to kind of slide my body up and down, trying to get that ball to roll along that edge. So I'll find the ball, take the ball, find that crease, and put body weight pressure into it. This is already somewhat uncomfortable for most people, so you just have to take a second to breathe. And then, while putting weight into that hip, I'll then kind of slide myself up and down, following that crease. Now, when you get down towards your pelvis area, you'll feel the muscle bellies start to change. If you feel like you're starting to get pressure into your inner thigh, you can actually start rolling back up. So it's actually just on the edge of that bony structure above the pelvic region. So after you would do that for 30 to 60 seconds, you would then stand up. The body would re-register how tight that muscle needs to be due to your current state of health, and you often get more of a release than what you had when you first started. So that is a good kind of self-therapy with a lacrosse ball to release some tightnesses in the front side of the hip, most notably kind of the psoas and some of these other deeper connectors. Okay, so give that a try if you're having any lower back problems, and hopefully it helps.